Hello, everyone. Today's conversation serves a dual purpose of addressing mental health prevalent the most today. And through this conversation, Mindful Running supports the Sajha Manch NGO that is working on COVID relief funds for the poorer sections of the society. All contributions to the Sajha Manch have 80G certificates for income tax exemption. I would like to invite Dunu Roy, who is a chemical engineer by training, social scientist by compulsion, political ecologist by choice, worked for over 5 decades in rural and urban scenarios, land and water management, secure settlements, safe work, environmental planning, leadership training, pollution control, poised on the delicate borderline between environment and development. He has been associated with the Sajha Manch for many years now, and I would like to invite him to talk a bit more about their initiatives. Hi, Dunu. You're on mute. If you can unmute, yeah, just unmute yourself, Dunu. We can't hear you.
One
Yes.
has to learn to deal with technology. Thank you for inviting me. Hello, everybody. It's really great to see people kind of gathering together in these very mild and bad times. And my name is Dunu, and I work with an alliance called the Sajha Manch in Delhi. I don't want to take up too much of your time, so I'll be very brief. This alliance is actually of very vulnerable people who are trying to protect themselves as best as they can in these terrible times, because in fact there is nobody else to protect them. The members are people who drive rickshaws or carry loads or do all kinds of labor in the city for a living. And as you would all appreciate, in the last 2 years almost, their livelihoods have been decimated completely. They are migrants. You may have seen pictures of so many of them walking home uh, last year, essentially because home was the only place that they could go. But they stay in the city, they help the city survive. They are the cleaners, the washermen, the maids, the drivers, the health workers, and so on. So the Saja Manch essentially is people like that. And as one of them recently said at a meeting, she said, if we don't look after our neighbors, then who will? And so that's the basis on which the Munch works. Currently, we are running 3 community kitchens. These are kitchens that have been set up by them. We are doing some of the crowdsourcing for funding so that they can run these kitchens. They provide 2 square meals a day. And in addition to these kitchens, each kitchen has a small health unit associated with it, where things like thermometers and oximeters and so on are available so that health can be tracked from time to time to find out who's ill and who can be helped with home care. And then there is a small computer with a printer so that they can try and access whatever government, non-government relief that is available for them. And just as an addition to that, even for you and me, technology is so difficult. For people who have small cell phones, which don't have internet, which don't have packs, it's so difficult to get online just to fill an application form. So you can imagine how difficult it is. And of course, most of it is in English, which is very helpful. So that is why we have tried to put up these information centers. So any assistance, any help will be very gratefully accepted. And bless you all. Thank you so much.
Thank you so much, Dunu. So, how did we even get here? I mean, the question comes out like a bullet wrapped in frustration and sorrow and fear, shot aimlessly into the open air from most of us, from different backgrounds and different life experiences. Some mourning the bereavement of their loved ones due to COVID 19, some recovering from infection, some caregivers to their significant others or family members in recovery, and some who had not been physically affected by the virus. Yet all of us have the same question in mind, and none of us are expecting an answer. The bullet in our hearts just needs a release. Why are people who have not witnessed death or even had a positive COVID-19 infection in their family experiencing grief? The answer lies in the larger connection among them, which is the human connection. So, one of the biggest impacts of the global COVID-19 situation has been its effects on our collective mental health. The stress, the anxiety, the depression stemming from fear, isolation, and stigma around COVID-19 have impacted all of us in one way or another. Kids can't go to school, we can't meet our friends, people are losing their jobs, the elderly isolated from their usual support network. And while we thought that was the worst that could happen, we started losing loved ones. And all the earlier issues that affected us became secondary, or rather, we started getting used to them. The past year, and especially the last 3 months, have been particularly tough on the healthcare workers who have been witnessing loss of people firsthand, and on all of us in varying degrees. The effects of the pandemic on our mental health can be far more lasting than the disease itself. To help address some of these issues, today I have Runar Helgi Andresan, a clinical psychologist from Iceland, in discussion with us today. So Runar graduated with a doctorate degree in clinical psychology from Rutgers University and then moved to Iceland. At that time, cognitive behavioral therapy, which is CBT, was relatively new in Iceland. He started working in a hospital setting, mainly in the psychiatric department, and also started teaching CBT at the University of Iceland. After 5 years at the hospital, he started working part-time in a rehab setting where he has been working since. He also started teaching sports psychology at the University of Reykjavik. Around 2011, he came across the ideology of acceptance and commitment therapy, which is ACT, and we will talk about this in detail during our conversation. Gradually, he became more invested in it. And as of 2016, it can be said that ACT has actually taken over CBT in his work, even though he was still working on data and publication from the CBT study. Today, he's running different types of groups based on ACT, such as ACT for chronic pain and ACT for mental health. During COVID, he has been active in talking about mental health during these difficult times. He has been writing articles in newspapers, giving online talks, and been interviewed on radio. He's working with post-COVID patients, both individually and in groups. So looking at Runar's background, it's a privilege to have him speak to us today to address some of the pertinent questions around mental health, which is even so much more important even now. Hey, Runar, welcome to the Facebook Live of Mindful Running.
Thanks. Hi, and thanks for having me.
Yeah, so how are you doing today?
I'm doing pretty good, actually. It's just past noon now in Iceland, and it's a beautiful weather. I was just listening to the radio when I came here, and they say actually the summer has arrived in Iceland. So we're pretty happy here in Iceland, I guess.
Yeah, it's very hot here in Delhi. So summer's been here for a while. Right. So thanks for joining, Ronald. I think this is a topic of much relevance, for all of us all the time. But more so even now, especially in India, with whatever's happened over the last year and especially over the last, 2 to 3 months. So yeah, I mean, as and when we have questions, from people, I will put those up. But let's just, dive straight in to the questions that
Sure.
I have for you. Yeah, so just wanted to start with a very, very basic question, Ronald. And it sounds basic, but, I think a lot of us need more knowledge and information around it. So what is mental health? When you talk about mental health, what is it and how does one really define it?
Yeah, first of all, we all have mental health, and it's just as important as physical health. I think it's best to think about mental health as like on a continuum, rather than people being mentally ill or mentally well, if I could say so. So we are all on a continuum, and we move up and down on this continuum based on what's happening in our life and how we are coping each time. Things that affect that is like our genetic background and upbringing, of course, and also life circumstances like we've been going through. The World Health Organization has actually a definition for this, and they say it's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productively, and is able to make a contribution to his or her community. So it's actually to be able to deal with normal life in a productive manner. So being mentally healthy means being resilient, I guess, able to cope, feeling like you are in control, which is actually something that people have not been experienced for the last 1 or 2 years, I guess. Being confident, feeling good about yourself, and at peace with your emotions. But also, I think a big part of mental health is to have a healthy relationships in your life. I think that's very important, and good relationships.
Yeah. And so like you said, it could be genetic, it could be what kind of, the experiences you go through in life. But are there any particular causes? Because, are there specific causes, especially that impact people? So what could cause, someone to feel unwell?
Okay. Yeah, there could be actually many causes for that. And first of all, I mean, it's normal. It's very normal to experience difficult emotions. It's part of life. It's normal to experience depression at times, or worries, sadness, fear, anger. All of these emotions are normal. But when they start interfering with our ability to function, they can start to develop into problems or disorders, and the causes of that can be quite many actually. It could be your background, like I was saying, like if you have history of like childhood abuse or trauma, neglect. Also social isolation, loneliness, which has been an issue now for a while for many people during the times of COVID. We have people who have, if you have to go through like loss, bereavement, or like in my work, I'm working with people who have chronic pain and physical health problems also affect your mental health, and it can develop into like depression or anxiety that we would say would be like a disorder. Now, drug abuse, all kinds of things that are happening in our life could actually cause mental problems. I guess I was just thinking whether lifestyle factors could lead to mental problems, and I think that lifestyle factors, including like work, diet, drugs, lack of sleep, they can all affect your mental health, but usually in combination with other factors as well, like I was saying, like genetic background and stuff like that.
Yeah. Thanks, Runar. I think it's like a combination of multiple things, and I think people experience certain things in varying degrees. Like some people might have it, for a few days. Some people might have it for longer. So there is a thin line between figuring out solutions yourself, and needing help, depending on having bad days and those bad days continuing for longer. So when do you know you need help? How does one recognize it to know that you are unwell? So there could be times when, you don't get proper sleep for like 2-3 days in a row, and then you're fine.
Right.
But when it goes beyond, so how do you know that? So whatever you told us, right now, people go through that all the time in varying degrees. But how does one know that that person needs help?
That's a good question, and sometimes people wait actually too long to seek help. But if you are feeling worried, nervous, overwhelmed, anxious most of the time, then that's an indication that you need to get some help for that. And also, if you are having emotional struggles that are interfering with your ability to like engage in healthy lifestyle, like eating, sleeping, exercise, like you were saying, you're unable to do those things anymore, or you're unable to go to work, attend to school, take care of things at home, or the relationships in your life are suffering. These are all indications that you need to take care of your mental health or seek help. Obviously, if you have suicidal thoughts or thoughts about harming others, you need immediate attention for that.
Yeah, right. And like I said, in your introduction, that you've studied and you work a lot around ACT. So what is ACT, if you can tell our audience, and how can this method really help people?
Okay. Yeah, like you said in your introduction, I've been using CBT, which is cognitive behavioral therapy, and now I'm using ACT, which is acceptance and commitment therapy. And telling the difference between the two can be a little bit confusing because they are both rooted in behavior therapy, which is like a much older theory. And in the ACT model, you are actually it's a combination of many things actually, where it's like 6 core principles in that, and one is to learning to perceive thoughts, images, memories, cognition, all like both thoughts and emotions for what they are without having to dispute them. So you can learn to stop getting like hooked by your thoughts, if that makes sense.
Yeah.
So in ACT, it's normal. It's actually normal and natural to have all sorts of difficult emotions, such as worries and sadness, etc. So instead of struggling with our thoughts or emotions, we're trying to push them away, which we tend to do. We sometimes try to avoid difficult thoughts and emotions. We learn to unhook from them and open up to these experiences we're having. And many clients that I work with find this quite helpful and relate better to this than the CBT approach, which is trying to take thoughts and change them, actually. In ACT, you're not changing thoughts, you're just trying to learn to live with them. And mindfulness is actually a huge part of the ACT model, learning to be in the present and to be here and now, and learn to relate to your environment instead of being stuck in the past or the future. And I guess the third piece that I would like to mention in that is a lot of work on values, what really matters for you in life. What kind of relationship would you like to have in your life? What kind of, how would you like to grow as a person? And what would you like to stand up for? Who you want to be. So it's a lot of value work as well. It's quite actually interesting to work with.
Yeah, and Ronald, this is actually very interesting, and I think most of us, kind of know this like in a very, very basic way. I mean, we know that one needs to be very mindful and one has to be in the present, but it's not always easy. I mean, you can try it, but you can be in the moment for about 5 minutes, and then again go back. So it's difficult. I guess it comes with practice or just being mindful every day for even if it's 5 minutes or so, and kind of consciously doing it.
You're right. You're right. I mean, we are so used to go on autopilot, right, in our life, just to go on, and we have all these thoughts and emotions, and we're not opening up to them, and not opening up to the environment. So yeah, you need to practice it, put it into your schedule, and in the ACT model, we have all kinds of ways of doing that.
Yeah. And we have a question, Runar. The question is ACT similar to meditation, where you accept and learn to deal with it and live in the present?
Yeah, basically that's similar to the way we practice it in ACT. We are not necessarily doing mindfulness exercises. While we do that sometimes, it's more to learn to use that in daily life. But it's just, yeah, it's similar to that.
Right. And, it can, so one is ACT, and there are different things that people resort to. The first is, of course, like you said, get help. If it's bothering you beyond a certain time, one should definitely reach out and get help. And I think that is something that people hesitate in doing. I mean, we've come a very long way in actually embracing it and accepting, mental health in India. But still, it's considered a taboo, and still, people are not very open in talking about it, with friends and family and so on. So, any tips to, for people who are actually going through issues, to actually want to kind of break these barriers and, make people understand that it's normal to have this thing? I mean, is there anything that they can actually do?
In order to break the barriers and the stigma around going to psychology, I mean, we have had that also in Iceland, I think, but that has been changing radically for the last 20 years. When I came here in the year of 2000, people were almost shy to me because I'm a psychologist, but now everybody is kind of starting to open up. But education, what we are doing today, for example, and just to talk about things, I think that's the way to do it. To gradually we will get over the stigma and continue from there.
Right. So educating people more, talking about it more at a school level, in offices, at workplaces, and getting to talk. I think that would be a good start.
And when you're raising your kids, when you talk about emotions and learn way to accept emotions and teach children to live with them more peacefully. So I think we can do a lot of things.
Yeah. We have another question, Ronald. So Ravi is asking, as difficult as it is for us to know ourselves, what are the ways we can identify the need for help in friends and family around us?
You mean to notice the needs in friends and families?
Yeah, so it's like it is difficult for us to gauge whether we need help or not. So how do we make sure that our friends and family who are going through it, who are not talking about it, how can you sense that someone needs help? How can you help them?
I guess it's always difficult to know what people are experiencing. I mean, that's the problem. We don't know what people are going through, and sometimes when we ask them, they deny it, right? But when you notice that they're not functioning the way they should be functioning, like in daily life, it's starting to affect the relationships, like I was saying earlier, or work and stuff. It's time to raise the question, but not all people are going to be accepting to that. So we have to be prepared for that as well. But asking questions about it and raising awareness of it, I guess.
Yeah. So what you're saying is that, if you have like friends or family members whom you sense is, on that thin line between wanting help and, so it's about talking about it and kind of sensing it as a gut and talking to that person.
Yeah, being supportive, empathic, but whenever you go to a person and say, I think you have a problem, they're going to respond, they're going to go into denial, right? So this thin line of just showing support and trying to gently talk about things and talk about your concerns with that person.
Yeah. And, it can be really difficult to find what is it that can help you. Mm-hmm. So say supposing, someone's going through issues and you kind of go and seek out help. So mm-hmm. How do you know? So different things help different people. Mm-hmm. So how much time should one give before giving up on the current treatment and probably exploring another? Because there mm-hmm. are various kinds of treatments for different people. Mm-hmm. And so how much time should you give to one treatment? And if that's not working, to kind of move on?
You're right. I mean, different things help different people. And first of all, there are therapists that have shown that they are effective. They have been empirically validated, as we say. They've proven to be effective. CBT, ACT model, and other mindfulness, to name a few, have all empirical basis behind them. So that's one thing. Another thing is has to do with a match between you and the therapist. Even though you go to let's say you go to an ACT therapist, and he's actually quite capable of giving you an ACT therapy, but the two of you don't match, and it's you sense that, and then it's okay to just find someone else. So. But if you are in therapy and you feel like you're not making progress, and the therapist just continuing doing the same thing, is not suggesting like different strategies, or is keep using the same techniques, and you remain stalled, you should try. You should consider trying either a different therapy or different therapists. Most people benefit from therapy like within, give or take, 3 months period. So it varies, of course, but it should you should benefit quite early in the progress. So if you feel like you're making some progress, it's okay. If you feel like you're stalled, do something about it.
Yeah, and I think that's a good point you made, Runar, where you said that I think the person needs to connect with the therapist first.
Yeah.
Right. So someone could go to someone who is, well known, but that if that connect is not there, then you obviously change the therapist and later change the treatment if and when. Right. So I think the first point is definitely, to connect with the person you're talking to.
Right.
So that's important.
Right.
And you can't tell in the first meeting. You have to probably go through it, a few times to see that, okay, it's not working out.
Yeah. But yeah, I guess there's no right time to change. You do it when you feel like you are like treading water with your current therapist. You're just not seeing the progress you like.
Yeah. Another question, Runar. Can you give some tips on how to have that conversation with a friend who is in denial without upsetting them?
Mm-hmm. Well, like I said earlier, I think it's always difficult to address something like this, but quite often though, quite often people are just feeling lonely, and just when you talk to them in a gentle manner, they actually appreciate it. So you have to jump, you have to take the Nike approach. Just do it. The Nike slogan, you have to go and do it, and talk to that person and see what happens. I don't have any technique how to talk to that person. Otherwise, just be genuine and be honest and show concern.
Yeah. All right. And the other thing is that we can all suffer from mental health challenges. At, like I said, in varying degrees. But developing a well-being can help prevent it to some extent. Like, how do we proactively, work on our well-being and make sure that, we don't suffer in the long run? and how can you go about building that well-being and resilience?
Yeah, when I was talking about the ACT model earlier, I didn't mention that the overall goal of ACT is to increase psychological flexibility, and many experts actually argue that psychological flexibility is like a super skill of resilience and mental health. So, and research has actually shown that it's associated with improved quality of life and well-being. So, being psychologically flexible allows you to stay like rooted in the present moment, like I was talking about earlier. When difficult thoughts, feelings, sensations arise, which they do. We all have difficult thoughts and emotions. And it enables you to take like a broader, more holistic view of the situation and to respond in a way that's more deeply in connection with your values. So for example, a psychological flexible person that feels anxious is they try not to fight or avoid that feeling. They run from it because they know it's just going to aggravate the problem. So instead, they embrace that this is a feeling they're having right now, acknowledge it, and then they choose their response in accordance with their values or the picture, what really matters to them in life. So to build a resilience, you need to have purpose. You know what you're heading. And when you have purpose, you will actually overcome many barriers.
Yeah. And that's very interesting because it's like, that book, Man's Search for Meaning.
Exactly.
Yeah, Viktor Frankl. I mean, he talks about purpose.
Exactly.
More so, yeah.
That's a great example. That's a great example, and it really says it all. I mean, when he was going through Auschwitz, for example, and he noticed what really that the people that had purpose, they actually survived this environment better than the others. So that builds resilience.
Yeah, right. We have another question, Ronald. When do you know therapy is not enough and you need medication?
That's another good question, actually, and I keep asking myself many times with my clients: is this the right time to do that, or is this not the right time? Sometimes I feel like we are using medication when we are experiencing emotions that are normal because of your circumstances, because you have some difficulties in your life, and because of that difficulty, you are experiencing difficult emotions or problems. When that is the case, I usually want to try different methods before we take on medication. But when you are not when you're unable to get sleep and you try different approaches to like sleep, improve your sleep, sometimes medication can be helpful. But for me, medication is neither good or bad. It's good when it's appropriate. It's bad when it's used and you don't need it. So it's always something you need to assess with each client. And I do that with my clients, for example.
Yeah. And is it also, Runar, that, if someone's going through therapy and, obviously that is a longer process and people might think that medication is like a faster thing because it's like popping a pill and kind of feeling better. So is it that people resort to medication because they want to heal faster and they don't have the patience to go through, suffering for a longer time?
Of course. I mean, when people go as the physician and they talk about their problems, quite often the physician doesn't have time or the resources to do anything else but to prescribe medication. So it's understandable they do that because that person in front of them is suffering, right? But sometimes we have to also realize suffering is part of being a human being. So learning to live with suffering through therapy is something that's also relevant.
Yeah. Another question, Runar, any techniques to overcome pangs of anxiety?
Like panic attacks.
Yeah.
Yeah, I mean, there are different ways of dealing with that. CBT actually has proven to be quite effective when dealing with panic attacks and panic disorder. Education about why you're having a panic attack and what happens with you physically is important. So you can actually find something on the internet about that, what happens with you in terms of you breathe in too much oxygen and it affects your brain and stuff, and how that all functions and ways to deal with that. But I would encourage any ways we try not to avoid having the panic, just to try to go through it with that education as well, when you have that education as well.
So does breathing help? I mean, just slowing down the breathing and just calming your mind at that point, because at that point the person is extremely anxious.
Yeah.
So maybe like some quick tips for maybe immediate, maybe a 10% reduction in, the anxiety pangs.
Yeah.
Well, is it breathing? I mean, does that help?
Yeah, that's what I actually, if you see in the movies, quite often you see people breathe like in a bag or stuff. It's because in the bag there's so little there's so little oxygen that you cannot breathe in too much oxygen. So it's not going to affect your brain in the same manner that's going to escalate you into a panic attack. That's definitely one way of doing it.
Yeah.
But education about anxiety and what happens to you physically is very important. So you understand what's going on, and you understand that this is actually part of your survival system that's just going on in your body. And I think it's good, some good videos like just on YouTube and on the internet to learn more about this.
Yeah. So, Ronald, just shifting gears, a bit now towards India, So, it's like the whole world has been impacted by the pandemic, and especially over the past year and a half, and more so in the last 3 months. So India has gone through much more than, I can even put in words right now. So the mental health for most of us has taken a toll. Most of us, I would say like probably all of us, but I would say most of us. So how do you take care of yourself with, that constant onslaught of bad news and the fear of catching the illness, because that could also produce anxiety, So any tips on how do you take care of yourself with, the bad news and just the fear, if I step out of the house, something will happen, or if I just, it's just too much fear. So how do you take care of that mentally?
Yeah, these have been difficult times, and what you are going through now is really difficult. And first of all, I think it's very important to accept what's going on. Acceptance is really important in this context. It's also to accept your own reactions, your thoughts, feelings, emotions, your sensations. So acceptance is very important. Accept that this is going on and we need to do something about it. First of all, you say there's a lot of news around. There's a lot of information coming in and stuff like that. Yeah. I think it's important to keep informed, but at the same time to minimize how much you're listening to the news. So if you're constantly listening to the news, constantly going on the internet or whatever to check on the new developments with the virus, you're going to be like obsessed with it. So I would recommend that you keep informed, listen to advice and recommendation from like national and local authorities, but to do this in a particular time period during the day. So not always be doing it, but at this time and this time I'll be checking it just to keep informed. Because it's not good to be not informed. That's gonna increase anxiety, and also to be constantly looking into and updating, getting new information is also gonna increase anxiety. So keep informed, but at particular times.
Yeah. So I think, there's too much information that comes our way through news. Also impacts us psychologically, that something will happen to us even if we are
Of course.
at home. It can happen to anyone, because you hear news of, people who haven't really ventured out too much, catching the illness. So there's just too much fear, So what you're saying is that stay away from too much overdose of information as possible, because that creates the fear also.
I also find it very helpful, and I do this for myself when I'm like in this context that we're talking about. I've been doing that. I ask myself quite often, what is it that I can control, and what is it that I cannot control? And there are a lot of things you can't control, and those have mostly to do with yourself, the way you actually behave, the way you follow the guidelines and stuff. But then there are other things that you cannot control, like decision making from like the authorities, what other people are doing, etc. So you need to let go of having that bothering you, right? And focus on the things that you can control.
Yeah. And, just some comments coming in, Ronald, that the amount of death we have had to deal with, deaths of families and friends. I mean, it's not a question. It's just a comment. And also news of close people, losing family. So there's just constant grieving.
Right.
That's So that's basically impacting, people a lot. And like you said, I mean, it's like certain things you have control on, and some things you don't have control on. So things around you will keep happening, but what is it that you can control? I guess what you're saying we should focus on.
Yeah, but also I know the way things are now in India. You're going through a storm. You're like in the eye of the storm. I mean, you need to find something to anchor you to like go through this storm, and that has to do with yourself. So all kinds of, like keeping a routine in your life is very important. Like when you get up in the morning, when you go to sleep, etc. And you have a better control of when you get up in the morning than when you fall asleep, right? So that's one of the things that you can control. Always get up at 7 o'clock. No matter how good or bad you slept during the night, that kind of keeps you. That would be an example of what can I control, what is it that I cannot control.
Yeah, right. And another question, Runar, how to deal with the feeling of loneliness, not being able to meet family or children? How to deal with it? Just the feeling of loneliness.
Yeah.
Because people can't travel, they can't meet their families.
Loneliness is a really, really difficult feeling to have. And nobody likes to feel lonely. Nobody. I haven't met that person. So again, that has to do with acceptance again. This is the way things are. So acceptance is a big part of it. Use all the technology you can use to stay connected with people, like talking on, like we are doing on like you could do that on Facebook, etc. And but I would do that also in a routine manner. So when you wake up every day, you know that at 5 o'clock I have 15 minutes with someone you love, and you talk to them instead of just thinking about it all day. So try to make a routine of that as well. But loneliness, yes, of course, this is the situation, the way it is. So it's understandable to feel lonely, and try to reach out and stay away from like bad health habits, like eating badly or whatever, and all kinds of things like that.
Yeah. So basically what you're saying is accept, what is happening, because you can't push that away. And the more you push that away, the more it will haunt you.
Right,
So the
right,
first
right.
step is to accept, and also look at it in a way of spending time with people in whatever mode virtually, and thinking of that as a thing to do in your routine rather than
Yeah.
I'm not able to do something.
Yeah, and the loneliness, what really fosters loneliness is also the lack of routine people have in their life. They wake up in the morning and they perhaps have to stay at home, do lockdown or something like that, and that could be really tiring throughout the day. So make a schedule, make like a schedule for the day. When to eat, for example, eat at the same time. When to exercise, because you can exercise actually, even though you're still at home, and try to keep up with your like personal hygiene and all these. So try to keep like a normal routine life the way you can, or as good as you can.
Yeah, right. And I think if you also have a routine in the day, it also helps your brain probably to not spend too much time thinking about when do you have to do this.
Right,
So
right,
if you wake up in the morning and it's exercise, then it automatically flows. You don't have to
right.
think whether I exercise in the morning today, evening tomorrow, midday day after. So if it's fixed, then probably your mind also doesn't need to work more to think when I have to fit it in the day. It automatically flows.
Right. It's like an anchor throughout the day, because you're feeling lonely and you're feeling bored, but you know that okay, 2 hours from now I'm supposed to be exercising, so that breaks down the time a little bit.
Yes. Yeah. Yeah. Right. And the other thing, Ronald, one of the biggest, things that we've seen is, of course, losing loved ones. So how can one cope with the grief of losing loved ones? So how can one help and support friends and family who have lost someone close?
I mean, grief is a natural response to loss, and it's a normal response to loss, and it's the emotional suffering you feel when something or someone you have loved is taken away. So it can be quite overwhelming to deal with loss, and you can actually experience all kinds of different emotions: shock, anger, disbelief, guilt, sadness, and it can also disrupt your physical health, making it difficult to sleep, eat, even think straight. So these are all normal reactions to loss. I'm just trying to normalize it a little bit, because this is really difficult to go through. But and the more significant the loss, the more intense your grief will be. So coping with the loss of someone you lost is one of the biggest challenges that people have, and it's a highly individual experience, though. So it's difficult to come with to explain this to people in a general way. And there's actually no right or no wrong way to grieve. I mean, the way you grieve depends on many factors, like your personality and the connection with the one you lost, etc. It will take time. We have the saying, right, that healing time will heal all, right, or something like that. Yeah. I actually don't believe in that, because unless you accept it and learn to live with it. So yeah, some people start to feel better in weeks, others in months. I mean, it's a process that you have to go through, and it's very individually. There's individual difference the way people react to it. Yeah. But it's important to be patient with yourself and allow yourself or allow it to naturally unfold.
Yeah. So I think one thing common which is occurring throughout Runar is acceptance. Yeah. So I think, that goes with most of the things that we spoke about. That's the first thing, that you have to accept it. And it's okay and allow yourself time to grieve.
Right. Yeah.
It's okay to feel sad. It's okay to feel a certain way. And, and so how do you help friends and family? I mean, is it like too much talking to them, too much calling them up? Because some people just might want to be, left alone. So how do you help friends and family who've kind of gone through it, if you haven't gone through it yourself, but a good friend or a family member has gone through it? So how do you approach that? Because you don't know how the other person is in, whether the other person is in denial or acceptance or
Well, that's the key. You don't know how the other person is experiencing. So unless you ask, you will never know, right? So asking, talking to people, people appreciate it. Even though they are tired of people asking, they appreciate that you ask. And I quite often hear from people that are going through grief that everybody is talking to them the days after it happened, and then suddenly everybody disappears. So make sure that people feel like they can come back and talk to you and check in on them again and again.
Yeah, I think that's very important, Runar, because it's like, you are in touch with friends and family who've lost loved ones. And then everyone, gets back into their routines.
Right, right. Yeah. Yeah, life
so
continues.
Yeah. So I think it's a good checkpoint to have to continuously, check with friends as a natural instinct.
And show support and ask. I mean.
Yeah. And just moving on, Runar, to physical activity. I mean, we've heard about it, we've read about it in multiple places. So how important, I mean, we all know it is important, but just wanted to hear your viewpoints. How important is physical activity for mental health, especially at times like this?
It's extremely important. I have the luxury of working in an interdisciplinary kind of work where I work with social workers, occupational therapists, and all kind of sports people. So when I'm talking to someone about their mental health, they actually go next and see a physical therapist or go for a walk. So I can actually see how much that is helping as well, because exercise improves mental health. It's affecting. Research is showing that it's affecting anxiety, depression. It enhances your self-esteem, and but it's important to remember this context that exercise does not necessarily mean aerobic or that you need to enhance your muscles. Going for a walk every day for like 30 minutes, it has great impact on your mental health. So. Yeah, did I answer your question again?
Yes, absolutely. And I think, that is one thing, I was actually talking to, one of my first conversations like this on Facebook, where we actually came to the conclusion that I think exercise is something which, people don't prescribe as much. Like they would prescribe other things, they would prescribe medication, but it's like just adding in your prescription that you need to walk for 30 minutes in a day. So it could be a part of the the prescription.
It should be a part of it. It should be a part of it.
It's like your medicine.
Yeah. I mean, we are physical and mental beings, and we need to. This is all. The whole body is all talking, and then the mental part is talking to the physical part, and the physical part to the mental part. So yeah, we should actually always think in multiple ways of working with mental and physical health.
Yeah, and just talking about the physical health part, Runar, a bit more, is like when someone is low, when someone is feeling depressed, it's very difficult to get out of bed, for example, and do a physical activity. But you know that at the end of the activity, you will feel good. But if someone is just doesn't want to meet anyone, doesn't want to get out of bed. How do you make sure that you just push yourself out of the door and just do that half an hour?
I had a person with me the other day that actually had this experience. What helped him was similar to what you were actually saying. He always pictures the way I'm going to feel when I'm done with this. So he went with his mind just a few, like 30 minutes ahead of time. How am I going to feel when I'm done walking in the rain and in the forest and back? And that it motivated him enough to get out of bed and do this thing. And then he got this experience of feeling much better. So it has to be self-motivation and to remind yourself that of the benefit of it. Try to do it, schedule a routine, and not treat it as an option. Like, should I go for a walk or shouldn't I go for a walk? No, there's no shouldn't. You just go for a walk, because that's like taking your medication, like we were talking about earlier. You don't ask yourself, should I take the medication or shouldn't I? You see what I'm saying? So you have to train your mind into not treating it like an option.
Yeah. It's like a thing to do. It's like popping a pill, so you have to go for a walk.
Right. And just do it. Again, I'm saying Nike slogan here. I'm just advertising Nike. No, I'm kidding. Just do it. I mean, it's a good slogan. So just do it.
Yeah. And I think one important point that you mentioned was, the person whom you spoke about visualization. Like he visualizes himself after a walk in the rain and how good he feels. So that makes him get out of bed and actually do it. So visualization techniques are also there, Runar, that help people to kind of...
Definitely.
Right. So that could also help people, right? I mean, just visualizing.
Right. And routine, schedule, like I was saying, and all that. And notice your thoughts, notice your feelings, notice your mind. Your mind is a wonderful organ up there. It's always trying to. Your mind is always trying to help you. So even the person who stays in bed, and the mind is saying, "Don't go out. Just stay in bed. Relax."
Yeah.
The mind is trying to help you, because he's trying to help you avoid discomfort that he feels that you're having, and but he doesn't have the larger picture, so his recommendations are not good at this point, but the intention of the mind is good. So learn to listen. I noticed that I'm thinking that I shouldn't go. I'm going to take that thought actually for a walk as well. So acceptance and diffusion, which is the act in the ACT model, and learn to diffuse or diffuse from the thoughts and the emotions. Yeah, I'm feeling sad. That's okay. I'm feeling sad, and I'm having these thoughts, and I'm going to take them actually for a walk.
Yeah.
So all kinds of way you can do it.
Yeah. Another question coming in, Runar. Could you talk to us about anger management issues? How to talk to someone with them, and if they can really be helped? How to take care of yourself while dealing with them?
Okay, so the question is,
how do you talk to us about anger? I mean, could you talk to us about anger management issues? How would you talk to someone who has anger issues?
Okay.
How can you really help them?
Okay. Yeah, anger is just like any emotions that we have, and to have anger issues means that the anger is out of control. So like I was talking about earlier, it's impacting relationships in your life, and all the things like that. First of all, accepting this is an emotion like any other emotion, and to learn to notice it and notice what kind of thoughts comes up with it, what kind of situation it arises the anger, and instead of trying to avoid it, you try to go through it with the anger, without having to express the anger. So anger is just an emotion like any other. So it's just something we work with similarly as to other emotions.
Yeah. And the question is actually, Ronald, how do you help someone who has anger issues, like as a
Yeah.
friend or a family member? How do you help that person?
Yeah, and it's similar to what we were talking about earlier when we talked about how to get someone to get help. If that person is accepting that they have anger issues, or if they're not. I mean, if they are not accepting it, they could actually. It's difficult to help other people. We cannot change other people. So all we can do is to talk to them, and if they are receptible to talking about it, you can make a recommendation to like go see a therapist or do something about it. But it depends if people are willing to listen and talk about it.
Yeah, because if it was, then probably it would have been easier. But it's just that, sometimes you just want to, be there for friends,
Right.
but you don't know what to do and how the other person will actually react.
That's the problem. When I was talking about control and not control, how other people behave, how other people react, it's not something you can control.
Yeah.
So all you can do is to talk to the other person and mention that you have worries about his temper, whatever. But unless that person is willing to accept that he has problem, nothing's gonna change, right?
Then it goes beyond your control. Yeah.
That it's beyond your control. Yeah.
Yeah. And if the person is willing, then of course, then you can go ahead and help and seek help.
All kinds of ways. I work like in the groups that I'm running, where I'm like in mental health. I have people with anger issues, low self-esteem, anxiety problems, having panic attacks, depression, and I teach them many techniques from ACT. One of the things that I have them do actually is to keep track of. It's just emotional tracking. Every 3 hours to check in on yourself. Okay, it sounds like it's a lot, but it isn't. And to check in on every 3 hours, how am I feeling right now, and whom am I with? What's the activity that I'm doing? This is a mindfulness kind of practice where you stop and look around. How am I doing? And try to come up with a name for the emotion. And you learn to live, you become more aware, acknowledge your own emotions.
That's a good point, Runar. I mean, I don't think we ever thought about it if your day is going well, you just don't think about it. If your day is not going well, you think about it all the time.
Right,
so
right.
We don't really pause and do that self-check every 3 hours. I think that's a good tip.
The people that do this, actually, I'm running a group like 12 people, 7, 8 of them would probably do this quite well, and they all benefit from it. That's a good
so they
way.
basically check every 3 hours of how am I doing right now. Yeah.
If you Google emotional tracking, you will actually find something about this and some pieces of paper to write on and how to fill this out. So there's a lot of things on the internet.
Yeah. Thanks, Ronald. Thanks for that tip. And just coming towards the end of the questions, Ronald. So the current situation is actually raising a whole set of human emotions right now. Yeah. So how important is it to cut yourself some slack and give others space and extend patience to your fellow human beings, like at times like right now?
So people are feeling irritated, you mean?
Yeah, I mean, there are like all kinds of emotions that people are going through,
It's the same. It has been the same here in Iceland. I mean, but now is the time to practice empathy and compassion. I mean, it's very important to remember that we are all in this together. So think of others, reach out however you can, and remember to ask for help if you need it. So there are ways of expressing kindness, patience, and compassion that we can go through. So first of all, we need to be extra kind to ourselves, but also to others. And this is a hard time for everyone. And humans across the world are sharing this experience with you. I mean, it's very important to remember that. And people are experiencing this from their own life, from their own background, from their own situation. So they make the experiences quite differently from yours. And this is all natural. And so we, instead of being judgmental and critical of others, we need to accept others as well, and learn to be compassionate.
Yeah. So I think one thing is obviously start with yourself.
Always start with yourself. Control, not control, and it starts with yourself, right?
Yeah. Start with yourself, and then, the whole thing about kindness and empathy,
Yeah.
I think in the last year and a half it was there, but I think in the last year and a half, it has really come out in a big way, where people are consciously making an effort to have that empathy with, at workplace, at home, because you never know who's going through what at what time,
Right. And
Now
I
we
think
are
that,
only seeing people virtually, so we can't even sense emotions as much.
right. And I hope we will develop more empathy and compassion for times to come, because that's what we need to focus on. We can learn from this epidemic that we need to show empathy and concern for others. So we can learn a lot from this.
Yeah, I'm sure. It's taught us already. The pandemic has taught us a lot, and yeah, some for good, some for not so good. But yeah,
Right,
a lot of
yeah.
learning.
It's a life changer.
It's a life changer.
Yeah.
Yeah. So Runar, anything, I think I'm done with the questions that I had. We've picked up some questions from people, as and when. People are thanking you, they're saying thanks for being here, wonderful discussion and all of that. So any, would you like to just, any, tips, any takeaways, anything that you want to leave us with?
Well, I feel like I'm repeating myself, but if not, I apologize for that. Well, it may be helpful actually for you to make a list of what you can and cannot control right now. So do get in writing instead of just everything that you put in writing. Kind of helps the mind to process and work through things. So that's one of the things that I would recommend people do. What is it in my life that I can control? What is it that I cannot control? And I'm going to learn to accept this and live with it. So, yeah, no, I don't.
Yeah, that's a good starting point, Runar. Absolutely important, because there are more things that you can't control than you can.
Right.
And that's where the mind goes all the time and keeps circling.
Yeah, and our mind, I tell myself this all the time. My mind is always trying to help me, but he doesn't have the whole picture. So some of the suggestions that are coming from here, I just listen to them and no, this is not helpful. And that's another thing that it's important to keep in mind. When you acknowledge your thoughts and you notice your thoughts, it doesn't matter if the thought is right or wrong, true or false. It's is this thought helpful or not? Is this helpful? Doesn't matter if it's true or false. Just is it helpful? And you can do that when you are able to diffuse from the thought, unhook yourself from the thought.
Yeah, that's an excellent point, Runar. Is this helpful or not? I think that is something that we need to ask.
Right.
Yeah, right. One last question, Runar, it has just come in. Do you think that this pandemic will have a large-scale impact on us as a civilization?
That's a good question. That's a tough question, right? Well, I think. Well, I don't know. I fear that as soon as we get over this, we will get back to our autopilot and get back on the track we were on. And I'm not sure we were on the right track. So I'm hoping we can learn from this. And but I have mixed feelings about whether it's going to happen or not. Human nature is always we run into the comfort zone as quickly as we can, and if we are heading there globally, even though different parts of the world are in different places, but when we get there, I'm fearing that we will be too quick to forget. But hopefully, we will learn from this.
Yeah, that's a good point. I mean, you're right. I mean, we are going through it right now, so we think that we are never going to kind of forget this and take all these learnings. But like you said, it's like the human thing, right? Tendency to forget things when things go back to normal. But I mean, currently, now that we are in this right now, we think, no, we are going to remember this forever and take these learnings with us.
It's like
that's the current feeling. Yeah.
It's like the recession, 2008. We went through that, and yeah, everything's going to change. I don't see much change.
Yeah. So I think this is what we had, Runar, and thank you so much for your time and addressing the most. And you've kind of addressed the most pertinent topic in everyone's mind all the time, and like I said, more so even now. And it has honestly been a privilege to have you talk to us, and some really excellent takeaways.
Thank you for having me. It's been an honor for me. Thank you.
Thank you so much, Runar. Thank you for your time.
Thanks.
All right. So now I invite Sumant Balakrishnan, also known as Bala, who is a singer and a songwriter from Delhi, for a short performance. Sumant is a lawyer by training. He began his professional music career as a guitarist with the modern rock band Barefaced Liar in 2008. He is also the co-creator of an art rock band called Dastan Live and a blues rock outfit called Knock Knock. He occasionally dabbles in the fields of human rights and is passionate about organic farming. So I will now invite Bala to the stream. Hi, Bala.
Hi.
Good evening. Thank you for readily agreeing to come, on this podcast for a cause.
No, absolutely. The pleasure is mine. I'm glad to be able to contribute in some small way.
Yeah, thank you so much, Bala. So the stage is all yours.
Okay. I mean, first of all, I'd like to thank Soumya for inviting me here, and I really enjoyed the talk and the questions we had so far. And incidentally, I mean, if I'm being honest, this pandemic has had a huge effect on me and my music as well. And in fact, the songs I'm about to play today, I wrote during the pandemic, and they're very much inspired by how I was feeling at the time. And Runar talked about a lot of great things like exercise and asking for help. And I think one important way for me to deal with all these things was through music. And so I just wanted to add that to the conversation. I mean, people who do have an artistic sort of output to process these kind of emotions is a really powerful thing.
Yeah, and I think Bala, you're lucky to have music to come to your rescue.
Definitely.
Also at times like this, Yeah.
Yeah, for sure.
Yeah.
So anyway, I don't want to waste anyone's time.
No, absolutely not. Absolutely not. In fact, this is great, Bala, and maybe you can, also, talk to us about the songs also, like why you did those songs and what made you, just a little bit background before you play them, maybe. But thank you so much. All yours.
So the first song I'm going to play today is called Orange Man. It's a song I actually wrote right around, I'd say, the insurrection that happened at the U.S. Capitol, and it really made me just think about, this kind of situation that everyone's going through, and on top of that, people sort of want to add more baggage to this kind of situation. And honestly, I was just feeling a bit angry about this situation, so I decided to write this song. And yeah, this is called Orange Man. story of the orange man, just a pawn in his orange plans. All that's left he will consume. All our faults have been due, 'cause you burn every bridge you lay, as you dance naked in the flame. Summer's gone and the winter's here. We've said goodbye and we've shed our tears. All that's left to do is disappear. All that's come to pass are our worst fear, 'cause I burned every bridge you lay, and you dance naked in the flame. I just blame you for everything. Maybe I am the one to blame. Memories that are worth holding on to, like tears in the falling rain. History will repeat itself, and you and I will come face to face.
Thank you, Bala.
No problem. So that was a song called Orange Man. This is one song I've released about a couple of months ago. So anybody who liked it can go check it out on YouTube, Instagram, and I'll be happy
Yeah.
to put some links here as well.
Yeah, you can just post the links also, Bala. I'll also do that to all your YouTube videos. And I hope you saw the comments that have come in.
Yeah, so I had my eyes closed for most of it, but I did, when my eyes were open, I saw a couple of comments.
Yeah, so I'll just put them up quickly for you to see. Loved your recent track. My favorite singer and songwriter. Bala is very handsome.
Wow.
Joy to listen to your song. And great voice, Bala. Yeah.
Thank you, everyone. So, yeah, I mean, so that song was a little political. I understand, but again, I mean, since we're talking about mental health, it really did help me sort of work almost through the anger I was feeling, and the kind of helplessness I was feeling. So music is a great way to kind of somehow, somewhat overcome these hurdles.
Yeah, absolutely. Yeah. Sure, Bala.
Yeah, and now I'm gonna play my the latest song that I've released, and actually the kind of song that you were interested in Soumya for this event, especially.
Yeah, so just so that everyone knows that Bala has recently released this new song called Over the Mountains. And I personally have been listening to it on loop, non-stop. So I really wanted him to come and play that for us here today, also because the lyrics kind of connect to the current times a lot. So yeah, Bala, over to you.
Yeah, so thank you for that, Soumya. So yeah, this track is called Over the Mountains, and I wrote this at a time when I was feeling quite low and sort of scared for my own future in terms of, when am I ever going to get to play a show again? What is the sort of future? And almost in a way, I mean, people were talking about doctors, lawyers, so kind of like nobody was talking about musicians, right? So in a sense, you felt kind of non-essential. And that's actually like most of the songs that I wrote that time were about this feeling. And this one especially was a little uplifting because, the lockdown did cause nature to sort of almost take over again. The kind of public spaces that we as humans occupy every day,
Yeah.
kind of not occupying those spaces. So nature was sort of creeping back in. So this song talks about obviously the existential crisis that we are facing as musicians today. But also in addition to that, we are after all part of nature, and at the end of the day, we're just organic matter. We go back into the earth after we're done with our time here. So that's essentially what this song talks about. And yeah, it has a bit of a backing track also here. So
Yeah, we would like that.
Yeah. All right, so this is Over the Mountains. Sunlight just over the mountains. We came here with the best of intentions, and nature will test our resolve. Faith lost in this man-made disaster, where no one will get what they ask for, and the faithful will answer the call. Answer the call. Bless you all. God bless you all. Blood waters cleanse my feet. We're all eating ashes now. Bury my heart and bury it deep. For forest can grow grass. Blood and water cleanse my feet. We're all eating ashes now. Bury my heart and bury it deep. Forests can grow grass. I'm over the mountains. Bloody waters cleanse my feet. We're all bleeding in ashes now. Bury my heart and bury it deep. The forest can grow grass. Blood and water cleanse my feet. We're all eating ashes now. Bury my heart and bury it deep. Forests can grow grass. I'm over the mountains.
Virtual applause. That was brilliant, Bala. I think, a lot of people have been commenting, and I wish we could say one more. Yeah. So I think I have kind of put most of the comments, but I think I would like you to see them once again, because I think you were playing and, I was kind of distracting by putting these comments up. So
It's
yeah.
okay. I was really not paying attention.
Yeah. So I'm just putting, all the hearts and all the claps coming your way. In fact, we have someone who's also posted the link to this song on YouTube on the side. And people are saying that, they're going to just add it to their playlist right away. So thank you. Yeah, thank you for that, Bala. Wonderful. Bala, can't lose myself in those melodies and that voice.
Oh, thank you.
And I'm telling you, I mean, for like you said, for artists, you've also gone through so much, not able to perform and all of that. And I'm sure if this was like a setting in person, then people would have definitely kind of, said one more every time, you would
Yeah,
play a
I
song.
understand. No, and
Yeah.
thank you for having me. This is also the first kind of performance I've done in a long time. So, and also the first time I've ever played over the mountain to any kind of audience. So, thank you.
Yeah, and I think we are privileged to have you here, Bala. I mean, this is the first platform you've actually come on and done this, and it's very nice because this is for a cause, and it's like a win-win situation. Kind of
Yeah,
doing this for a
definitely.
cause.
I do hope people generate and donate. I'm saying generate. Donate generously is what I mean.
Yeah, yeah. Thank you, Bala. I mean, it was really such a wonderful performance. Thank you so much.
Thank you, Soumya, and thank you everybody who's listening.
Thanks. Okay, so we are done with today's podcast on mental health, followed by Bala's performance. So I would like to thank all of you for giving your time on a Saturday evening, for a topic so pertinent right now. So, and to hear Bala, and his songs, I will put up the links to the YouTube songs of Bala's. So thank you everyone for joining, and I'm sure there are many takeaways from the session to reflect upon. I hope all of you have found this beneficial. Feel free to leave your comments on what you thought. And before signing off, don't forget to contribute whatever little you can to support the Sajha Manch, which builds, I will just repeat what Dunu said in the beginning. So the Sajha Manch builds community kitchens, information centers, and health units, and helps people regain their livelihood, which was lost due to COVID. So the link for the contributions is in the advert that I've been posting. So whatever the amount that you're okay with, any amount kind of will go for this effort, so kindly do that. And I would just like to end this by saying that life offers purpose. We spoke about purpose, that Runar said. So life offers purpose and meaning, but does not promise fulfillment or happiness. And this is something that I have picked up from the book that I mentioned, sometime back in our conversation on Man's Search for Meaning by Viktor Frankl. And so life offers purpose and meaning, but does not promise fulfillment or happiness. Viktor Frankl's logotherapy and his experience at the Nazi concentration camps is a big testament to his quote. It echoes that life may throw unprecedented traumatic events at us. However, these events may also be the doors opening for us to discover new meaning and purpose, whether we wish to explore it or not. It is our free will. Those who dare to open these doors and explore the hidden meanings behind them may find it to be an efficient way of coping with grief in finding new directions. Thank you all. Thank you for joining.